Resuming debate, the honourable member for Sherwood Park, Fort Saskatchewan.
I'm splitting three ways, and my questions will be for the Minister of Mental Health and Addictions. My colleagues have asked about a company called Fair Price Pharma, run by former BC Public Health Officer Perry Kendall and a partner. Their business is selling heroin. The results of an order paper question show that in a 2-year period leading up to December 13th of last year, the minister met with Fair Price Pharma on September 15th, and her predecessor met personally with Fair Price Pharma 4 times, and that health officials met with them an additional 7 times. That is a dozen meetings in 2 years, a lot of meetings for a minister and officials with one company that's in the heroin business. What is being discussed in these 12 meetings between Liberals and this heroin company?
The Honourable Minister.
Thank you, Madam Chair. And just to be clear, I, as Minister of Mental Health and Addictions, have not met with Fair Price Pharma. And the September 15th meeting that the member is referencing was actually a meeting of ISET, with another office and not my department. There were members of my staff who were present at that meeting, invited to listen in. But just to be clear, we meet with experts in this field. Dr. Kendall was joined by Dr. Schefter and other experts at those meetings, and we need to talk to experts, even if we don't agree with them, Madam Chair.
The honourable member for Sherwood Park, Fort Saskatchewan.
Madam Speaker, this is not a dispassionate expert. This is someone who went from the public health world into selling heroin. 12 meetings in 2 years is not normal even for an expert. Again, I'll ask, what is being discussed in these meetings? What is Fair Price Pharma asking this Liberal government for?
The honourable minister.
The Dr. Kendall that the member is referencing was part of the BC government, not the federal government, just to be clear. And as I mentioned before, those meetings that were held at ISET, I did not attend those meetings and was not privy to the discussions around the table. We talked to
the honourable member for Sherwood Park, Fort Saskatchewan.
12 meetings in 2 years. 4 in-person meetings with this heroin company and the former minister. And this new incoming minister must have been briefed on what the nature of this close relationship was and what was being discussed. For a final time, why is this government meeting 12 times in 2 years with this heroin company? What is being discussed? What is Fair Price Pharma asking for?
The honourable minister.
Madam Chair, the member across the way knows perfectly well the meetings were held at ISET. The member also knows that I have not met with Fair Price Pharma. The member also knows that my predecessor did meet with Fair Price Pharma. That being said, what I do know is across the way they do not listen to many of the experts we need to listen to, including Mom Stop the Harm. I'd love to know why the Leader of Opposition refuses to meet with families who know what they need in their communities. We will meet with everyone. Why don't they?
For Sherwood Park, Fort Saskatchewan.
Madam Speaker, a lot of people want to hide their meetings with drug dealers, but I would have expected better from this minister. What is the purpose of these 12 meetings with these corporate drug dealers?
Honourable Minister.
Madam Chair, I've answered this question already. He can keep asking it, but we will speak to all experts on what matters, and most importantly, to save lives, all tools and resources.
For Sherwood Park, Fort Saskatchewan.
Is the Government of Canada party to any contracts or agreements involving Fair Price Pharma?
The honourable minister.
No.
Honourable member for Sherwood Park, Fort Saskatchewan.
Will the minister demonstrate her point either way by releasing all contracts involved in safe supply?
Pharmaceutical contracts are the purview, excuse me, Madam Chair, of the provinces in terms of prescribed alternatives.
The honourable member for Sherwood Park, Fort Saskatchewan.
We put forward a motion at the Government Operations Committee asking for any contracts to which the federal government is a party. Liberals have been filibustering to block the release of those contracts. If no contracts existed, I suspect Liberals wouldn't be motivated to filibuster to block their release. Will the minister agree to release any contracts to which the federal government is a party involving these drug programs?
The honourable minister.
Madam Chair, federal funding towards prescribed alternative programs goes to the operations of the programs themselves. As I've said, contracts with pharmaceutical companies for prescribed medications are between the province and those pharmaceutical companies. We support implementation of programs.
Honourable member for Sherwood Park, Fort Saskatchewan.
There have been 12 meetings with a heroin selling company. This government is refusing to release contracts involving the Government of Canada and corporate drug dealers. Why won't the minister tell us what was discussed in those meetings, and why is the minister sitting on these contracts?
The Honourable Minister.
As I've stated, but I will repeat for the benefit of the committee, Madam Chair, contracts such as these are between provinces and these companies, but just to clarify,
Sorry.
costs go to
keep
actual
going.
medication.
Perfect. The Honourable Member for Kelowna Lake Country.
My questions are for the Minister of Mental Health and Addiction. The Minister's Department approved of an open drug use policy in public places, including parks and playgrounds in British Columbia in 2023. Does the Minister believe children seeing drug usage normalizes drug usage for children?
The Honourable Minister.
Madam Chair, we're committed to a compassionate approach to this public health crisis that is clearly anchored in public safety as well. But we need to understand that those who use drugs need to be directed to health care. Families and communities have a right to be safe wherever they are, parks, beaches.
The Honourable Member for Kelowna Lake Country.
Does the Minister believe illicit drug supplies left in parks and playgrounds increases the risk of accidental overdoses of minors?
The Honourable Minister.
We are moving through this public health crisis with a strict lens on public safety and public health, and we will work with jurisdictions.
Honourable Member for Kelowna Lake Country.
The Minister has confirmed tonight that the leading cause of death of children and teens, sadly, in British Columbia in 2023 is illicit drug toxicity, correct?
The Honourable Minister.
Yes, the toxic drug supply is costing us many lives in many communities, and it is absolutely tragic.
Honourable Member for Kelowna Lake Country.
In Campbell River, a major drug seizure was reported in February 2024 having hydromorphone pills with evidence suggesting they were diverted from government-funded supply. Did the Minister ask for a briefing on this?
The Honourable Minister.
As I've stated before, both in the House and in this committee, the RCMP, based on the most recent data, has shown that there has been no increase in hydromorphone diversion in Canada over the last decade.
Honourable for Kelowna Lake Country.
Is the Minister concerned about diversion of government-funded drugs like this to children?
Honourable Minister.
I think we're all concerned about diversion because it is illegal.
Member for Kelowna Lake Country.
Is the Minister aware that the drug seizure in Campbell River had fentanyl powder molded into the shape of gummy bears and dinosaurs?
The Honourable Minister.
All diversion is illegal, Madam Chair, and extremely concerning. This is why law enforcement is a key pillar of our strategy.
Honourable Member for Kelowna Lake Country.
Does the Minister not think these were targeting children?
The Honourable Minister.
All diversion is illegal, and we are concerned for all our children.
The Honourable Member for Kelowna Lake Country.
Is the Minister taking action to stop these drugs from getting into the hands of children?
The Honourable Minister.
We continue to work with law enforcement and jurisdictions to ensure that diversion is mitigated.
Honourable Member for Kelowna Lake Country.
Has the Minister given any directives at all to stop these illicit drugs from getting into the hands of children?
The Honourable Minister.
We are working closely with public safety and criminal justice partners to ensure that diversion is mitigated.
The Honourable Member for Kelowna Lake Country.
I think we should take that as a no. September 2023, the Minister received a letter from 17 addiction medicine doctors who said, quote, "We are regularly seeing and hearing in our practices that diverted hydromorphone is causing harm to both adults and children." Does the Minister agree with their statements?
The Honourable Minister.
I've both met and received letters from experts on their concerns, and this is why we have listened to them and heard them and taken their advice, and also listened to other experts to ensure that we create programs with jurisdictions that are safe.
Kelowna Lake Country.
Has the Minister implemented any of the recommendations from the letter that I referenced?
The Honourable Minister.
Health Canada has worked with prescribed alternative programs to ensure that protections are in place.
Kelowna Lake Country.
Has the Minister taken any action to mitigate government-funded drugs being diverted into the black market?
The Honourable Minister.
That is the role of law enforcement, Madam Speaker.
The Honourable Member for Kelowna Lake Country.
Has the Minister taken any action to mitigate government-funded drugs from getting into the hands of children and teens?
The Honourable Minister.
The government funds programs. Provinces have contracts for the medications.
The Honourable Member for Kelowna Lake Country.
Government-funded drug policy protocols allow for prescribed fentanyl to minors without parental knowledge in BC. Does the Minister support this?
The Honourable Minister.
To be clear, no child in BC has been prescribed fentanyl. That being said, I'll leave it there.
The honourable member for Kelowna Lake Country.
Does the minister believe that there should be a minimum age for when youth can receive recreational fentanyl?
The honourable minister.
Madam Chair, no one should be receiving recreational fentanyl.
The honourable member.
Does the minister believe that parental agreement should be required before their child is prescribed a dangerous drug like fentanyl?
The honourable minister.
As the member well knows, the relationship between a physician and their patient is a sacred one.
Kelowna Lake Country. Oh, member for Kelowna Lake Country. There's time is up.